Perfect. Thank you so much. Good morning, everyone. I hope you all are having a great week. We're going to go ahead and get started, okay? So we're going to go on with a little bit of an introduction just to get you all, to know who essentially are your guest speakers today. I will go ahead and get started. My name is Vidal Soto. I'm a fourth year undergraduate student at UCR, and I am studying neuroscience there. I'm very excited to be here. I myself was in HOSA throughout my high school, and I was actually president of my charter club. So I'm very excited that you guys are part of this great organization. It definitely has an everlasting effect. As you can see, I'm a pre-med student. I'm looking forward to what I can do in the future. And it's a great resource and definitely will provide you with some great resources for the future as well, okay? So I hope you all stay on that path and continue on to your high school. So I'm gonna go ahead and let my fellow team members introduce themselves so I can open the floor to you all. Thank you.
Hi everybody, my name is Krina Patel. I'm a third year biochemistry major at UCR.
Hello, my name is Herlene Judge, and I'm a second year neuroscience major at UCR.
Hi, my name is Faiza Ahmed, and I'm a second year bio major at UCR.
Hi, my name is Terry. I am a fourth year undergraduate here at UCR, and I'm studying biology. So I just wanted to take this time to tell you a little about seizure first aid and the importance of seizure first aid with my story. So I'm actually an epileptic, so having seizures was like a common occurrence growing up, and my first seizure growing up really it was very frightening to like my mom, and being an immigrant as she is, she didn't really know how to handle the situation. It involved a lot of crying and a lot of cursing to God, but that's my experience with seizures. And throughout my years, after going to like a neurologist and getting diagnosed, I've gotten much better. And now that she's much more informed and well educated on what seizures are, she's less fearful about what it is. So it's a matter of education and understanding what seizures are and what we can do to prevent them, or not prevent them, but to treat them, and to give first aid to people who are having seizures is the key to all this. So here we are today trying to inform you guys on what are the correct steps to seizure first aid and how you can help a person with epilepsy or a person who's experienced seizures like I have in the past. Thank you, and we'll carry forth with our presentation.
Thank you for sharing that, Terry. I appreciate that. So class, we're gonna go ahead and get started with some learning objectives. Just essentially you all can, know some goals, essentially what you can get from today's presentation, okay? So the first on the top left, which is labeled number 1, we want to define a seizure. It's importantly to know what a seizure is so you can identify it and essentially know what to do with that moving forward. And if you look on the right-hand side as our learning objective number 2, it is how seizure first aid works. What are the steps? We've broken down very simple, so it can hopefully be easy to follow. And finally, once you know how to perform seizure first aid, we want to provide some resources in the future, just in case you can perhaps know what numbers to call, what to do if you ever do experience some of these things, as it is very common amongst us. So it is important information to know. Okay, so I'm gonna go ahead and allow them to continue on with the presentation and allow my fellow member Karina to go on with it. Thank you.
Thank you. So to start off, what is a seizure? A seizure is when there's an increase in brain cell activity. So brain cells, they're able to send signals that either excite other brain cells or stop the excitement of other brain cells. And normally there's a balance between both signals. But when people have a seizure, there's an imbalance in those signals, or there's more exciting signals than signals that stop. And this results in changes in the body. There are 3 types of seizures that create 3 different overall changes. So on the left, you can see there are atonic seizures, which literally means without tone. So when the muscles don't have tone, the body will go limp. And as you can see in the picture, the person may have a droopy head, or they'll fall forward, or they'll have a loss of muscle control. And second, in the middle, there's tonic seizures, which means stiffening. So in the picture, you can see that the person is very stiff and they can't move their muscles. And that's what is characterized by tonic seizures. And on the right, the third one is tonic-clonic seizures, which means stiffening and jerking movements. So this type of seizure has 2 different phases. The first one is tonic, which we saw in the previous type, where the person will be very stiff and they won't be able to move their muscles. And then they'll go into the second phase, which is the clonic phase, where they'll have where they will experience involuntary jerking movements. So now we'd like to do a little trivia. It's not really a pop quiz, don't want to scare you, but about the myths that people believe about epilepsy. So I want to say some statements, and I want you guys to use the chat feature to answer whether you think it's a myth or a fact. So if you can all pull up your chats, that'd be great. The first one is it a myth or a fact that epilepsy occurs only in children? And the question is also in the chat if you miss it. This is great. You guys, okay. So this is a myth. You guys are all correct. Although there are a lot of children that do get epilepsy, anybody of any age, race, gender, anybody can develop epilepsy. So second, is it a myth or a fact that you should hold down a person while they're having a seizure? Okay, I got most of you with that one. A couple of you got it right. It is a myth. So you should never hold the person down while they're having a seizure. This is because a person that is having a seizure is unable to control their actions like you saw with the different types of seizures. And this could either hurt them or you. So to be safe, you should instead remain calm, time how long the seizure lasts, and call 911 if the situation calls for it. Okay, third, is it a myth or a fact that epilepsy, a disorder which causes seizures in the brain, is not a mental or developmental disability? Great, you guys got it. So this is a fact. Most people with epilepsy are fully functioning members of society. It's not a necessity that people that have seizures are mentally or developmentally disabled. And fourth, is it a myth or a fact that epilepsy is always hereditary or passed on through the family generations, as it says in the chat? Great, good job. This is a myth. Some people that do develop epilepsy can be from the family line, but it's not very common. In most cases, epilepsy is developed during a person's lifetime and is not passed down through the generations. Great, thank you all for your participation. I'm going to pass it now on to Harleen.
Currently, 3.4 million Americans have epilepsy, and it affects more than 65 million people in the world. In addition, 1 in 26 Americans will develop epilepsy in their lifetime. Seizure prevention is case-specific, but in general, to prevent seizures, an individual should take the medicine in a timely manner, prevent possible brain injury, maintain heart health, have a safe and healthy pregnancy and childbirth, and receive required vaccines. If you do encounter an individual who is having a seizure, call 911 if it is the individual's first seizure or they ask for help. The seizure lasts longer than 5 minutes. The individual has trouble breathing and or is choking. The seizure occurs right after another. In addition to calling 911, you can also perform seizure first aid. I'll now pass it on to my fellow team member, Phasia.
Some symptoms you may see in an individual having a seizure is they may have a blank expression on their face, and they may seem zoned out. They may be chewing even though they're not eating, fumbling, wandering, shaking, and they may have confused or slurred speech. Depending on health conditions, age, and race, individuals may be more prone to the development of seizures and epilepsy. For instance, epilepsy is slightly more common in men than women, and epilepsy is more common in individuals of Hispanic descent, and the reason for this is unknown. And Two risk groups would be individuals over the age of 55 and infants. Individuals over the age of 55 are more prone to epilepsy due to the fact that they are at a higher risk for strokes, tumors, and brain tumors or Alzheimer's. Infants are more susceptible to the development of epilepsy or seizures because they are more susceptible to neurological infection. Some risk factors associated with seizures are bleeding into the brain, brain tumors, babies who are born too small for their age, the use of illegal drugs, and a family history of epilepsy. And now I'm going to pass it on to Terry.
Okay, so seizure first aid can be broken down into 2 steps. And the very most important step, the first step before you should even do anything, is to call 911. So calling 911 allows for a layer of protection and safety for the individual who is having the seizure, because we don't really understand the severity or the nature of what's causing the seizure to happen. So having 911 and having emergency medical services come, they're much better equipped to handle the situation, and it's just much more safer for the person having the seizure. So step two follows a very simple acronym. It's CTTS, right? CTTS stands for clear, turn, time, and stay. So the first letter is clear, which you want to clear the area. You want to give the person room. This is just in case they have any jerky movement, and it just makes them feel less overwhelmed when they do regain consciousness. You want to turn them onto their side. The next is you want to time the seizure, as mentioned. So you want to time how long the seizure is going. So when emergency medical services do arrive, you can give them the time of the seizure, and it just helps them better understand what's happening. And you want to stay with the person having the seizure. So CTTS, you want to stay with them because as they regain consciousness, they're going to be confused. They're not going to know what's going on. So you're going to be there to tell them what steps you've taken, what measures you've done to help them, and then that emergency medical services may be on the way. And so a quick recap of the do's and the don'ts of seizure first aid. So you do always want to call 911. You do want to clear the area. You do want to turn the person on their side. You do want to time the seizure, and you do want to stay with them or remain with them. And then the don'ts, the do nots. So you do not want to panic, and you do not want to hold them down, and you do not want to put anything within their mouth. So after having a seizure, or if you're wondering where to get more information about seizures, a great free material to use or a hotline to call is the Epilepsy Foundation. The Epilepsy Foundation is a reliable resource that can provide information and independent resources about seizures within the US. So their number can be found very large on the screen. If anybody would like it, you can feel free to write it down. But they're just an overall great resource to understand more about epilepsy if you want to talk face-to-face or firsthand with another human being about seizures and epilepsy. So who to contact, right? So after you'll be given to a primary doctor, you'll go to your primary doctor, who will then recommend you to a specialty doctor. This doctor is a neurologist. A neurologist is a doctor who specializes specifically within the brain. So a neurologist will perform a complete neurological exam or a brain exam to find out if an area of the brain is functioning normally. So they're going to try to find out what or why is causing your seizure, and they'll try to get to the bottom of the seizure and eventually get you help. So these are a list of neurologists within the Inland Empire. It ranges from the UCR Health, the Riverside Neurology, Loma Linda University, to the Kaiser Permanente. So these are all great neurologists within the area. And so who to contact? So there are many types of medications to help manage seizures, and there's many surgeries to help manage seizures. So a physician is an ideal person to go to, especially since they're the ones who may be the ones referring you to the neurologist. So great physician is the Riverside Community Hospital. They take all types of insurances and they provide great care for patients. So their number can be listed on the screen below. This concludes our presentation on seizure first aid. If you have any questions regarding seizure first aid or college lifestyle for that matter, please feel free to ask us away.
Hey, yeah, go ahead. I was going to ask a clarifying question because on one of the slides, I thought I saw call 911 after 5 minutes of a seizure. And then I also saw call 911. It looked like immediately when you see a seizure. So I just wanted clarity on that.
Yes, the call 911 is when you're taking the steps to seizure first aid. So it depends varying from person to person. So for my example, I'm an epileptic who has consciousness. So you wouldn't really call 911. So it varies from person to person. But our thing was if it passes the 5 minute mark, then you proceed with seizure first aid. And seizure first aid, you always call 911. Does that answer your question?
Thank you. I appreciate it. Yes.
We have a question in the chat. They want to know, does it matter which side you turn them on?
Oh, no, it does not matter which side you turn them on. You just mostly want to turn them onto their side. So just in case that there's any saliva or anything from their mouth that they don't choke on it. So that's why you turn the person onto their side.
Okay. We have another question. It says, what type of medicine or surgery is available? What are the benefits to these?
I can go ahead and answer this one. So there's many types of medications. There's different types of seizure suppressing medications. So as we went over and discussed early on, seizures are due to an imbalance of brain signals. So these different medications will and specifically interact with specific neurons in the brain, and then that will essentially help out this balance that is different from person to person. So there's trazodone. There's a lot of very fancy names for these medications, but your primary doctor will be able to refer you to a neurologist, and they will go ahead and work with you into a specific case-to-case situation. And in regards to surgeries available, yes, a lot of seizures are in fact caused due to tumors pressing on either the frontal lobe or different parts of the brain. So after they do neurological exams, they can go ahead and see that there's tumors in these specific areas, and they can perform surgery to go ahead and remove these tumors that are causing pressure onto the brain, therefore causing these surgeries. And therefore, what are these benefits? The benefits are that in majority of the cases, a lot of the seizures, cease to exist when tumors are removed. That is best case scenario. In terms of medication, you must take it on a timely manner to prevent these surgeries from occurring. However, there is still that possibility. So I'll let one of my team members answer the next question. Thank you.
Thank you. The next question is, can a seizure last more than an hour and can it be fatal?
I can answer this one. There's rarely seizures that last more than an hour, but anything over 5 minutes is within the danger zone. So that's why we always encourage people to call 911 if it's lasting more than 5 minutes. Depending on the scenario or the type of seizure, some people may have long persisting seizures, which can total up to an hour, but anything longer, usually past the 5 minute mark, is usually dangerous.
Okay. Thank you. The next question that we have, it says, what are some more common ways that people treat epilepsy? Is it mostly medication or is there other ways?
I can answer this question. So there, like Vidal said earlier, there are some medications you can take to kind of suppress the seizures or manage them. And also surgery. So if you do have a tumor pressing on some part of your brain, you can have surgery to have that removed, and that would essentially stop the seizures. And also, it also has something to do with your diet. So I don't know if you guys have heard of the keto diet, and it's been a fad diet, but it was actually designed for kids with epilepsy to try and control that. So there's some changes you can make in your diet.
Okay, interesting. Thank you. Oops, let's see. The next question. They wanted you to explain what you guys mean when you say you are undergraduates.
I can go ahead and answer this one. So I like that question because it essentially clarifies me growing up. I didn't really know what an undergraduate was until I was like a sophomore in high school when I had to, start thinking about college because I'm a first gen student. No one in my family had ever gone to college, so I didn't even know, essentially in middle school, I didn't even know what a senior was, to be honest with you. So I think it's very important that we pass on that form of education because it's important to know. If you don't know how you're supposed to get there, right? But what an undergraduate is, so after high school, you get your high school diploma, correct? And directly after that, there's different degrees that you can get. So there's trade schools, but in regards to your question, an undergraduate is someone that is pursuing a bachelor's. So that is a four-year university. Like UCR, we are undergraduates because we are trying to get our bachelor's. There's bachelor's in sciences, and there's also bachelor's in arts, depending on what major you choose. So in regards to a major, it is essentially what you want to specialize in while you are an undergraduate. After you take your general education, you start taking more upper divisions, and you want to, and it'll help you get a job in the future. So that's essentially what an undergraduate is. Hopefully that made sense.
Yes, thank you. Okay, the next question we have, does epilepsy impact the brain? If it does, how bad does it impact the brain?
I can answer this one. But yes, epilepsy does impact the brain. From like a scientific standpoint, you don't really need to understand it, but your brain has certain channels, ion channels that lets certain ions through. So people with epilepsy, their ion channels aren't working correctly, and you might have an influx or an efflux of ions. So there might be too much ions going in one direction and too much ions in the other direction, or it's not closing correctly. So it's just causing your brain chemistry basically to be different from other people, and your neurons, they won't fire the same. So you might have different issues like bodily movement, and as mentioned, like all those tonic and seizures are an example of this. So to summarize, yes, it does impact your brain. How bad is it? The degree of how bad it is depends from person to person. So how bad it is just depends on who you are and what type of epilepsy you have.
Okay, thank you. And I think you kind of answered that. It said, does seizure impact other parts of your body? And you kind of discussed that too, Terry. So thank you. The next question is, what do you do when you forgot or don't call 911 and the seizures lasted for more than 5 minutes?
I think the best thing to do in that situation is, as soon as you can remember, call 911 immediately. That's I think the best thing that you can do in that situation.
Okay, thank you. The next question was this: if someone has a seizure, can they like remember it after they regain consciousness, or it depends on the person?
Oh, that also depends from person to person. So some people will remember it, some people won't. Some people, like I take me as a great example, because some people when they do seize, they have some form of consciousness, so they understand that they are seizing. Or other people, even some people have like an awareness that a seizure might be coming along. It's almost like a sixth sense. Where you know that a seizure might occur, and then it'll happen. So you have like a split second to tell like your friends and family, whoever around you, to take precautionary seizure first aid just in case.
Okay, thank you, Terry. The next question is, do strokes and seizures have similar symptoms?
Yes, they don't exactly have the same symptoms, but you'll have similar symptoms. Like example is like drooping, we've mentioned. So like people who have stroke, they'll droop on like their left side of the face. They'll slur their words. An example of people who have stroke is you'll tell them to recite their ABCs and they won't be able to do it. This is seizures and strokes have somewhat similar symptoms, but they are not the same. So in both cases, a stroke or seizure, we always advocate for 911.
Great answer, thank you. The next question is, if someone is having a seizure while they're eating, should we try to remove the food from their mouth?
I can answer this one. You should never stick your hands in the mouth of someone that's having a seizure because, again, you can't really know what they're going to do, and you don't want them like biting down on your hand. So like Terry had mentioned in the steps, you should always turn them to the side, and that will ensure that they don't choke on their food, and it'll probably just fall to the side or whatever it is. But you should never stick your hand in someone's mouth while they're having a seizure.
Okay, thank you. And the last question that we have is, does the type of seizure you have, all those different ones, tonic, clonic, do they affect how disoriented you are after a seizure? Does it affect your symptoms? After a stroke, it says here, but I think maybe they're asking about the seizures.
I'll answer this one. So yes, essentially there's many different types of seizures. So they are, case specific. So to answer your question, yes, some people, as Terry mentioned, some people are fully conscious after the seizure, while others, they can be totally disoriented, which is why it's important to stay with them afterwards, so you can inform them that, hello, a seizure did happen, this is how long it happened, and it's important to that information so they can inform their primary doctor if it is out of the norm, so they can take precautionary measures to further prevent these seizures in the future.
Okay, thank you. We have about 5 more minutes. Do we have any last questions for our students? For our medical students? Pre-med students? Pre-med students. This was very informative. I appreciate it. I know a long time ago of people having seizures, people were just very scared and not sure. There used to be a stigma that people were possessed when they were having seizures. And so it's really nice to, have this education where people know that it is just something kind of misfiring in the brain. And, it's not that evil force inside you that many people grew up hearing from grandparents and things like that. So we appreciate you coming out today, all of you. And thank you so much for coming. And we're excited to hear that, Vidal, that you were a HOSA president and talking to our HOSA club now. So this is awesome. Thank you.
No, thank you for having us. Yes, everyone, HOSA is a great resource. I had so much fun with it. I met so many great people, even competitions, going, to places, and just the whole energy. Hopefully we can go to that soon. It's a great experience. So again, thank you for having us. We hope you all learned something. And now you are educated in seizure first aid. Congratulations.
Thank you.